bank loan.
Basically, the market's so desperate to get some kind of positive return. Interest rates.
You pay attention with so much at stake.
Seas are rising and chronic flooding will be the new normal.
You navigate, you listen, you keep an ear out. You pay attention, and so do we. We tell the stories of our time every day.
In the 26th day of testimony and on the 139th witness, Shahar Tsarnaev wept.
We unearth what would otherwise stay hidden.
There's just a lot of hate in this world, and that day, for that hour, we were humans.
Across the street.
The Red Sox have won the World Series.
And around the globe.
It's here and now.
This is Modern Love.
This is WBUR's All Things Considered.
This is only a game.
This is On Point.
This is Radio Boston.
On air, online, on demand, and on stage in the heart of Boston.
I'm Jack Lepiars. Welcome to WBUR City Space.
Always looking forward, paying attention, and knowing that your story is one of our stories.
Good morning. I'm Bob Oates.
I'm Lisa Mullins.
I'm Meghna Chakrabarty.
I'm Jeremy Hobson.
This is 90.9 WBUR Boston.
Good evening. Welcome. My name's Amy McDonald, and I'm programming this beautiful space. How many people are here for the first time at WBUR City Space? Great. Come back. Check our website, wbur.org/cityspace. I like to call WBUR City Space the 92nd Street Y of Boston. There's really nothing like it in this city, where we not only have author interviews and policy debates and politicians, but we have live podcasts and we have dance and we've had a coffee house opera. We had Margaret Atwood here a couple weeks ago during the Handmaid's Tale staging at Harvard's men's basketball court. We've had food. We've had all sorts of different things. So there's something for everyone. So check out the website. Do come back. It's such a beautiful space. You feel like you're in a cocoon. The streetscape, they're double panel windows so you don't hear the ambulance or the fire engines usually, and occasionally hear the rumbling of the tea. This is the second in our series called Boston Brilliance. It's the brainchild of our CommonHealth host, Khari Goldberg. And the first one was CRISPR, with these two brilliant scientists, millennial scientists who have their own lab, which Khari said is like getting your PhD when you're 13. Tonight we have Dr. Walter Willett, who's head of the Department of Nutrition at Harvard Public School of Health. He is cited as the most influential nutritionist. He is cited more than any other expert in his field. He has cited the connection between soft drinks and obesity, between eating red meat and colon cancer. His book is Eat, Drink, and Be Healthy. Am I right? Eat, Drink, and Be Happy. We were just talking about having a glass of wine with dinner backstage. And we're also interested in food. So welcome, and please join me in welcoming Dr. Walter Willett and Khari Thompson, our producer for Morning Edition, who is our interlocutor for these series. Thank you.
All right.
Thank you.
Yeah, I was going to say, I think I have this right. I'm pretty sure he sits on that side myself. It's like, unless you want to be me for the day. But thank you all once again for coming out to City Space tonight. As Amy mentioned, this is our second event. Really enjoyed the first, and I hope you guys enjoy the second. Obviously, we had that introduction for Dr. Willett, who is responsible for hopefully saving most of us who eat too much steak from colon cancer. I put myself firmly in that category, way too much steak and meat. But welcome, and thank you so much for coming.
Thank you, and good to be here.
All right. So I want to start off a little bit on kind of the personal side of the diet part, because most of us think about diet in regards to our everyday, what do we eat? How's it making us feel? How's our weight? How's our health and things like that? So I definitely like to start there. How about you give us, as a dietary expert, one big do and don't for our everyday diets?
That's trying to boil down 40 years of research into 2 sentences.
You can give us 3 if that helps.
Yeah, the do is eat a lot and enjoy a lot of healthy foods and beverages. How about that?
Hey.
To start. And I think at this point in time, the overall message I would say, both for our personal health and for the health of future generations, is shift toward pretty much the plant end of the dietary spectrum.
Yeah, so we're definitely going to get into that because I know you have some interesting views, and one diet in particular that I think you find most interesting and that most of us have heard of. And also, if I might ask, what about you? What is a sample week in Walter Willett's diet look like, if I might ask?
Yeah, well, that's changed a lot over time. I grew up in the Midwest, and that meant eating a lot of red meat, potatoes, and gravy. That's a good standard Midwestern fare. And there was really not an opportunity to try a lot of other foods that are from other parts of the world and other cultures. That was basically the Midwestern diet, and had a good bit of dairy on top of that, of course. 5 glasses a day, I was taught growing up. So. Then I've had the chance to travel, and then also our research has really showed as that unfolded that was not going to be the healthiest diet that we could be eating. And so I've really followed the evidence, and also followed a lot of our experiences living in the Mediterranean area, in Africa, around the world. And so my diet today is definitely more toward the plant-based end of it, with lots of vegetables and fruits and whole grains. I do have some yogurt, a little bit of dairy. Not much red meat at all. That's not part of my diet anymore. But mostly I've found that it's a lot more interesting, a lot more varied than I experienced growing up. So I'm enjoying it.
Absolutely. Also, really quickly, where in the Midwest are you from?
Wisconsin and Michigan.
Okay, I'm from Indiana originally.
Okay,
yeah.
right.
Yeah, Northwest Indiana, about 30 minutes out of Chicago. Go Bears.
Yeah, right. So you know about this diet.
Yeah. No, I know about this. I grew up on it. I was actually telling Dr. Willett backstage. Basically, every meal I had growing up had some kind of meat and a kind of rice. So I came from a Puerto Rican household.
Okay,
but
the rice wasn't Midwestern, but
because we were trying to do the Midwestern Puerto Rican thing. Right. But basically, every other place we went to was meat everywhere all the time, and such. And actually, you mentioned the dairy, the 5 glasses of dairy. Show of hands. How many of you guys grew up hearing you should drink lots and lots and lots of milk growing up? It strengthens your bones,
right, yes.
all that stuff. Dr. Willett told me something very interesting backstage about what they've found out about milk consumption that, if you don't mind, would you share?
Sure. Well, this has been an enigma that's been around for over 50 years, that if you look around the world, the countries with the highest milk consumption actually have the highest fracture rate. And those are the Northern European countries and North American countries, countries that do not consume milk as adults, partly because people develop lactose intolerance and can't have much milk intake. Those low milk countries actually have the lowest rates of fractures, not the highest rates of fractures, which is quite contrary. And it's been a paradox, but now the data have unfolded as, again, we've been looking at this for 40 years. And part of it is we just don't need a lot of milk to form our bones and keep them healthy. It's partly we don't need as much calcium as has been recommended. But also what we see is that drinking a lot of milk during childhood and adolescence does accelerate our growth rate and make us get taller. And some years before that, before we realized that milk had such a growth-promoting effect, we saw that people who were taller had quite substantially higher rates of fractures. And that's probably because it's just easier to break a long stick than break a short stubby stick. It's the mechanical part of it's pretty simple. Or if you do fall from a higher distance if you're taller.
Yeah.
And so it does. It actually probably is that this high milk consumption during childhood and adolescence does actually increase the risk of fractures later in life. Now, all that said, of course, we do need some calcium, but we can get it in other ways than drinking a lot of milk. Modest amount of milk, it seems, is not an issue, but the recommendations to have 3 or more glasses of milk a day is really not justified by evidence.
Bet you weren't expecting to hear that today. Yeah. It's like all of you guys who grew up on that. If you have kids and grandkids, it's not too late to save them. But so having kind of done the talking about everybody's kind of personal diets, now I kind of want to get into the big picture. The one that you've really become known for, and that's looking at diet from a global perspective. Eating healthier to help the planet. And since we all kind of think about diet every day, most of us don't think about this. How did you come to really decide that we needed to take this global view?
Well, we've realized, I think, during the last few decades that the issue of climate change and other environmental stresses are huge. And I think we all, 20 or 30 years ago, realized that climate change was happening, but most of us thought it was on a time scale of many hundreds of years or thousands of years. But it has become apparent more recently that there is an acceleration, and we don't need fancy statistical models. We can see it right before our eyes, that the Arctic Ocean opening up, glaciers retreating. We lived some years in Tanzania, which there Kilimanjaro was covered with snow all of the time by a very thick ice cap, but that's going to be gone in a few years. So these things are happening at a much greater rate than we thought. And it's also become apparent that what we eat has a major impact on climate change and other environmental impacts. In fact, agriculture overall has the biggest environmental impact on many aspects of sustainability: land use, species extinction, water use, pollution by nitrogen and phosphorus. It's at this time still transportation and heating do have the biggest direct impact on greenhouse gases, but agriculture is about 25-30% of the total greenhouse gas production worldwide. And what we eat has a huge impact on the amount of greenhouse gas produced. So this is something that we really, I think, pretty much everything we do should be done looking through it with looking through a climate change lens, as well as, say, a nutrition and health lens.
And I think that's, we'll kind of get to this a little bit later, but I think that's interesting because we spend so much time now thinking about, what kinds of cars that we drive and what kinds of energy that we use in relation to climate change and how it's affecting the planet. I think that, diet is something we do on an everyday basis that we don't even necessarily think about. And so it's this very fundamental way in which we affect things. Really quickly, before we go too much further, one way that we want you guys to interact with us and ask questions is through our kind of Q&A website, slido.com. It's something that you can access on your phone, and we have an event password. So if you guys, so if you guys have phones, feel free to check that out and type in that event password, BB521, and you can input your questions, and we'll pull them up towards the end of here. So think about your questions while we're doing this, and don't forget, because we definitely love having audience interaction, and we know that, how can you guys not have questions about food? Am I right? And so, obviously, getting back to this, we thought about, the climate change part and how we're on the verge of, potentially global catastrophe here. Can you give us some numbers, perhaps, to help us understand, or some context to understand how much food and food waste are contributing to this?
Well, again, in terms of total greenhouse gas production, agriculture is on the order of 25–30% responsible for that. But what we eat does have huge impacts. The worst end of the spectrum is red meat consumption, basically cattle production, production of pork and lamb, but especially cattle. And this is serious for several reasons. One is just the inefficient conversion of grain to food. For every calorie or gram of protein we eat as beef, we have to put about 20 calories into that cattle, into that cow or bull in terms of grain converting to red meat. So it's that conversion's inefficient, but also the whole time that the cattle are alive, they're producing massive amounts of carbon dioxide just by breathing, but also in the rumen there's a very major amount of generation of methane and other greenhouse gases there. So putting this all together, both inefficiency and also massive methane production. This is sort of like burning coal for energy or worse.
And you know, I actually had this question. So when I think about planet or like kind of planetary health, there's the part where I think about our the human health, in a global sense, like the health of our species, but also like third rock from the sun, the planet itself, the giant sphere Earth. Is there one that this research and stuff kind of refers to more than the other, or is it all connected to the sense that it's like one necessarily helps the other, or affecting one affects the other?
Sure. Well, human health and planetary health are very intertwined and interlocking. We obviously can't live as a species on a rock. It's sort of dead, otherwise dead, circling the sun. I did co-chair a major commission that was published a few months ago, in the journal of Lancet, that tried to tackle this issue, this big question of how can we feed what will be about 10 billion people by 2050 on the Earth as a whole, a diet that is both healthy and sustainable. And that's a huge challenge because today we're not nearly feeding the 7.2 or so billion people a diet that's healthy. We have almost 1 billion undernourished children still, and on the other side of it we have several billion people that are overweight or obese, and the diet quality of the rest of the population is far from optimal. So from a health standpoint, it's not good. But from an environmental standpoint, we're badly off track. And we are on track to almost double the temperature increase by 2100 that is thought to be consistent with viability. We're headed for about 4 degrees centigrade increase compared to the goal of 2 degrees or less increase. And again, our food systems are driving that. And at the same time, we're actually destroying and degrading the very resources that we need to produce food. Yeah. So this is a really sticky ball of wax. So we started, how to come at this is almost a little bit overwhelming. Yeah. And we did come at it starting with defining a healthy diet. And fortunately, over the last few decades, we have around the world, different investigators come to a pretty good understanding of what the elements of a healthy diet would be. And fortunately, it's not inconsistent with where we need to go on a planetary health basis. And essentially, as we talked about briefly, this would mean a modest amount of animal source protein. We don't have to all become vegans. In fact, it won't work if we all become vegans, because it will leave some grazing land that we can't use for much else, essentially unutilized, and we're going to need that for producing some modest amount of food. So it would, and our diet should emphasize healthier plant-based proteins like nuts and legumes and seeds, a modest amount of seafood, and there is, again, some room for a modest amount of dairy and occasional red meat consumption. And everything we've seen, interestingly enough, that pretty much describes the traditional Mediterranean diet. Yeah. If you put all these pieces together, that's what it could look like. But it can also look like diets from parts of Africa, parts of Asia as well. It wouldn't be the same diet, but these elements can be put together. So we calculated by using 3 different models, if everybody adopted this diet, we'd prevent about 20 to 25% of premature deaths. So on the diet side, we can see pretty much where we could go. And then there's another branch of science that has developed the concept of planetary boundaries.
Yeah.
And it's obvious that there are boundaries. We can't continue to just produce more greenhouse gas. We can't continue to use more water. We can't continue to pollute more. There are boundaries there that we can produce some greenhouse gas, but this branch of science has defined what those boundaries are, and they're continuing, of course, refining their precision. And so we could see whether, if everybody ate this diet, could we remain within those planetary boundaries? And the answer is we couldn't do it if that's all we did. We do have to reduce waste and loss of food very substantially by about half. That's pretty aggressive challenge, a goal. And we also need to change the way we produce our food in some major ways as well. And fortunately, again, we have our colleagues in the agricultural sciences who have been working on what they call precision agriculture, use just the right amount of fertilizer, not anymore, use just the minimal, the right amount of water. And we are overusing fertilizer in many places around the world and underutilizing it in Africa and other poor countries as well, that could increase their crop production substantially, that will be needed. So in the end, if we shift toward a healthy diet in a major way that we mapped out, cut food loss and waste, and transform our food production system, we can barely squeak by, it looks like. So this is going to be a big set of challenges for everybody.
Yeah, so the outlook sounds like, fairly grim in a way, in that we really need to we really need to kind of get on this and stick with strict parameters. At the same time, I imagine that there are going to be a significant amount of people that don't conform to that, or maybe it takes time, whether it's because maybe people don't have the resources or aren't in the right place, and some people are just like, well, that sounds dumb, I don't want to do that, I want to just do what I'm doing, it's fine. Is there any kind of acceptable, have you kind of factored that in terms of what is the realistic, perhaps, expectation for how many people might actually be able to do this? And is it okay if it takes longer than 2050?
Well, good questions. And of course, it comes down to exactly what you described, people, and changing human behavior. And there are clearly, we see it every day. I should add that achieving this, to make this possible, requires several big assumptions. One, that we have, by 2050, pretty much entirely shifted to green energy. That has to be part of it, and because our agriculture system uses a lot of energy, both for transportation, fertilizer production is a big user of energy, and we've seen all the kinds of resistance there, as you know well, with very powerful economic interests that do not want to change. So the barriers are really going to be to a large extent, political interests, economic interests, and overcoming those. And then, of course, you mentioned also just human behavior. And there's a lot of nihilism that people won't change their behavior, but in fact, we do see big behavior changes, not all of them to the good, of course, that we've seen about a tripling of sugar-sweetened beverage consumption since 1970, and that's a big driver of our obesity epidemic. But we've also seen a huge reduction in tobacco use. So with policies, with a combination of policies and education, we can have quite major changes in behavior. and also shifts in food intake as well. So it's possible, but it will take the involvement of pretty much everybody, whether it's individuals making choices at home or at work, but also leadership at the national and international level that we don't have right at the moment, obviously.
You know, it's interesting that you mentioned the green, green energy part. Mm-hmm. Obviously, we have one of our senators, Ed Markey, who is a big supporter and sponsor of the Green New Deal. So is that something that you support in conjunction with all the things that need to happen from a dietary perspective?
Absolutely, and to his credit, Markey's really been a leader in this for decades. That I think the rest of the U.S. is just starting to pay attention to what he's been saying for a long time. But this really does imply that the Green Deal is, or something, whether you call it that or not, is part of it. And another part of it is equity. That of course is a huge challenge sociologically within the U.S. We're going in different directions, and this does imply that there be more equity.
And that's something I want to touch on a little bit later. In regards specifically to making sure everybody can access this. So you mentioned the commission that you were on and kind of the planetary health part of this. You also helped bring some of these changes to Harvard, if I understand correctly, in terms of helping revise their diet a little bit. Can you tell us a little bit about what's going on in Harvard's lunchrooms these days?
Right. Well, I've always thought it's very useful to try making your changes at home, because you always learn some things in the process. That we worked quite a bit on getting trans fat out of our food service at Harvard a few years ago, and that was informative because I learned it was sneaking in on the pre-fried French fries. So even though we weren't buying any trans fat directly, it was coming in the back door. And we solved that once we understood it. But yes, we've had really good partners with Harvard Dining Service, and then the university also does have a green policy that includes energy use and various other aspects. But they've brought the food service under that umbrella as well. So, for example, at the grill at the School of Public Health, they basically eliminated red meat from there and have a lot of other variety of burgers, several kinds of veggie burgers, but also some fish burgers and chicken burgers and things like that. So there's a variety, and their sales actually tripled when they did that. So it wasn't that people abandoned the grill. So it's obviously not your average population. But perhaps even more impressive is at University of Massachusetts Amherst, their student food service is really doing fantastic things there. And linking it with education. It's not just what they put on the counter at the food service, but incorporating education about both health and environment, and also cultural education. They're bringing in knowledge about the experiences of cultures from around the world through the food service there. So it's really particularly impressive in a state school that's financially stressed. They're saving money in the process, because red meat does cost a lot.
Yes.
And, using more plant-based protein sources, they find they can actually deliver meals that are healthier and more interesting and cost less.
Yeah, it's like, and we were actually talking about this backstage a little bit, just for a little reveal of what happens in the green room, But you mentioned that red meat is very expensive, and I know at home, my wife and I actually have tried to get a little bit away from our meat consumption a little bit, particularly like I said, we were eating meat almost with every meal for a little while, whether it was chicken or beef and things like that. And then once we did a couple of weeks away from doing that, the grocery bill looked a lot better, because it really can be very expensive, and it's it's. I feel like the price should make it more of a perhaps more of a luxury commodity as opposed to something that we eat with every meal. But I think that in the United States, particularly in some parts of it, like the parts where we grew up, that's just kind of a cultural thing. You eat lots of red meat. And so ultimately, like, kind of the hint I'm getting from you is that not only is that good in, environmentally and, from health perspectives, but it's also better for people's pockets too. Do you think that that will encourage, more organizations, more schools to perhaps take on this initiative?
I think so. That is a good motivation. That some people are motivated by health, some people by environment, some people by animal welfare, some people by economics. So all of these things are pointing in the same direction. So I think we just need to make everybody aware of that. Use all of the motivators that we can.
Oh, excellent. So one thing that we've talked about meat quite a bit here, and red meat, especially excessive consumption of red meat, has been linked to colon cancer and also cardiovascular disease, increased risk for that, and obesity. And then the environmental aspect. One thing I'm interested in is the advent of lab-created meat. I'm curious as to it might solve some of the environmental aspects where you're not using as much agriculturally, so you're not raising livestock that are putting methane into the air, and there's all these resources that you don't have to use for them. However, does that solve the health problems, or do you still have some of the same issues? Do you kind of know about that a little bit? Have you looked into this?
Yes, a bit, and there are several ways that these artificial meats are being created. One is sort of more purely biochemistry, like you're describing, but also then the cultured meats, which you actually take the cells of real animals and you grow them on a plate instead of as an animal. But as you imply, we really need to think about both the health and environmental impacts of these alternatives. First of all, I think it is good that we have a lot of creativity because there's not going to be one size fits all solution here. From what I've seen, if these are imitating red meat, they're going to have many of the same adverse effects of red meat. They're probably not going to be optimal, although like the Impossible Burger is there, because you have control over the biochemistry here. You can have healthier fats than in the average steak that you might get, but it comes with quite a bit of sodium still, which actually red meat naturally has very little sodium in it. So it has some more negative aspects than natural red meat does. So it's probably not going to be hugely different. The point is that a lot of the plant-based protein sources like nuts actually have some very positive health aspects, healthy fats that bring down blood cholesterol levels, fiber, that red meat has no fiber intake. So part of what we have when we eat a lot of red meat, we're missing the positive benefits that come along with a lot of plant-based protein sources. And on the environmental side, these products are very unlikely to ever come close to actually having, like eating the natural plant-based sources of foods, because they're still produced in factories that have lots of energy inputs, and you've got to feed these cells too. So you're going to be feeding them things that are produced on farms probably more efficiently than that. You can almost anything you can do will be more efficient than your Angus on 4 legs. That's just so inefficient. And I think though that these, I make the analogy, they may be sort of like a nicotine patch for people trying to get off of red meat. Some people are culturally or almost addicted to red meat. And this is going to be less environmentally adverse than your Angus, but not as environmentally friendly as actually eating directly the plant-based sources of protein.
So it's like basically no matter what you do, essentially there are costs, So just because you get rid of some aspects of some of the negative aspects, there are others that need to be accounted for.
Right. It's not zero. Right.
Exactly. And really quickly, we'll be getting to questions soon. So if you have a question and you're burning, to ask it, remember to go on Slido.com and put in the event code, because we'll be winding down and getting to those questions here soon. So you mentioned it in your last answer about healthy fats. We've generally been taught fat is bad. And we've kind of gone through, I think, phases in terms of our understanding of diets. And I think that the low fat, high carb, or low fat, low carb, high protein. There are a number of different dietary pitches that people have, but fat always seems to get a bad rap. So essentially what you're saying is there are ways in which we can benefit from eating the right kinds of fat.
Right. That, as you correctly say, that back in the early 1980s, this really started, that the idea that all fat is bad for us. And of course, even if you don't say it, the implication is that carbohydrates are going to be good for us because we have to eat. And if we're not going to get those calories from fat, we're going to get them from someplace else. And it turns out to be mostly, by default, carbohydrate intake. So there was a big push. This really became the centerpiece of national dietary guidelines, that we should avoid all fats wherever possible. And as we started to look at the data, even in the 1980s, that just didn't fit. We were looking at cancer risk, and we didn't see that higher fat intakes were related to higher cancer risk, which was the hypothesis. And I did realize, even when those guidelines came out, that that was not based on any solid data. It was guesswork, really. And as the data did come in, it did not support those recommendations.
Do you think, sorry if you don't mind, do you think that it actually just had something to do with the word fat, perhaps?
Yeah.
That maybe that there was some bias that, like, oh, fats, that means it's bad and it makes you fat? Like,
yeah, I think it does. That fat was just viewed as negative, that eating fat makes you fat. In fact, I even had colleagues, I won't name names here, that said you can't get fat eating carbohydrates. But big names in Boston science, I would tell you. But, the farmers have known for thousands of years in the Midwest and in the Middle East before that, if you want to make an animal fat, you put them in a pen so they don't run around and get exercise, and then you feed them grain, and they get fat. So we should have known, for, again, bowing on thousands of years of agricultural experience, you can get fat eating carbohydrate. But it's just so easy to sort of link fat with getting fat. The other reason is that fat does have more calories per gram than carbohydrates do. So it's sort of easy to make that simplistic connection. But our energy regulation, our caloric regulation of what we eat is much more complicated than just eating a certain number of grams of food per day. There are many feedback and control mechanisms. And again, it does seem as though we get hungrier if we have on low-fat diets. People really have a hard time maintaining their weight and maintaining a low-fat diet if they have an alternative. And then we've also realized, and studies of the Mediterranean diet provided some of the early clues, because when we actually analyzed what people were eating on the traditional Mediterranean diet, it was about 40% of calories from fat. It was not a low-fat diet, yet they had the longest life expectancy in the world. So that was a clue that that it wasn't inevitable that we got fat and had ill health eating high-fat diets. But again, as the data came in, we could see the type of fat was hugely important. And trans fat just stuck out like a sore thumb there, that was a really bad form of fat. Unfortunately, as of last year, it's illegal to produce it in the United States now. So that was one of the things that does give me some optimism that we can make changes if they're science-driven and supported by policy, as well as information. But the unsaturated fats like olive oil and soybean oil, if it's not partially hydrogenated, it actually reduces blood cholesterol levels and lower heart disease risk. The evidence for that is now overwhelming. So the type of fat is really indeed what's important. And in parallel, the type of carbohydrate is also very important, that sugar and refined starches have bad effects on our metabolism. We can see in short-term studies and on disease risk in long-term studies.
And one thing I'm thinking of as well, do you think that some of the misconceptions about diet? I have all these different fad diets that come out, the keto and, I can't even remember all of them now. Like they're just like buzzing around and like bouncing around in my brain. But, all these different kinds of diets that come and go. Do you think that can be a little bit of an impediment to getting to this dietary health norm, that like so many people are going to be like clinging to the stereotypes that they are not able to make that switch over to understanding that it doesn't have to all be so cut and dry?
Yes, I mean, of course, there's a huge distraction of fad diets, and many of them are have sort of half-truths or maybe quarter-truths to them. Like the Atkins diet really was the first popular low-carbohydrate diet.
There you go. I think that's one of the ones I was thinking of.
Yeah,
Just slipped my
and now it's sort of the rerun of it as paleo diet. And the half-truth of it is that it is really beneficial to reduce our intake of all of the refined starches and sugar that are a huge part of the caloric intake in the average American diet, and people do get better if they reduce that. But it doesn't automatically mean that eating a large amount of red meat and sausage and butter is good for us. That equation was completely illogical. So that you can have a healthy diet that is relatively low in carbohydrate, but again, it depends then on the sources of protein that you're replacing, using to replace those carbohydrates with. But in addition, again, we do need to look at pretty much everything through an environmental lens as well. And I asked one of the primary sort of founders of the paleo diet how many people he thought we could support on Earth if everybody ate this meat-based paleo diet. He said about 200 million people. So, and others have calculated that maybe it's 800,000 if you sort of stretch it a little bit. So somebody needs to start looking for another planet.
Yes.
If they're going to
it's like
that.
meanwhile on Earth too.
Yes. Yeah.
Wow, that's an astonishing number. It's just like, yeah, you probably want to rethink that. And kind of on that line of thinking, for people who don't have, perhaps the resources or, kind of in places where some of these unhealthier diets are, ingrained, and maybe they don't have the money to buy everything organic and locally sourced and things like that. Are we in danger of leaving people behind, or is there a way that we can bring everybody along with us, kind of like, regardless of wealth and privilege? Like, can everybody get on the right track here, or is it inevitable that some people might get left behind?
Well, you're talking about a huge societal issue. This is back to the equity issue. And one scenario is that the countries that have more resources, the U.S. has huge resources compared to most other countries in terms of land and water, the basic ingredients for food production. And it is possible that we could sort of put up a wall and have our own sustainable environment here and feed people healthy. It wouldn't be too hard to do that, obviously. But we're already seeing that's not a recipe for a stable world, that other parts of the world that are going to be hungry and can see that other people are living very differently, that's a recipe for instability. So that's, I don't think, a good long-term solution. It is possible to have equity, but we're not on that track now. Just like climate change, we are on track for increasing disparities, both within the United States and in that, if we look at income, we can also see that in the quality of our diets too, that probably people who are here, people you see at Whole Foods are doing very well in terms of improving diet quality. But when we look at people with lower education and less resources, their diet quality is not increasing. In some ways, has gotten worse. So the gap we saw between year 2000 and 2012, the gap in diet quality in the U.S. doubled during that period of time. So it's, and then we can connect all the dots now. We've seen the same patterns happening in life expectancy. And that should be really alarming, what's going on. I don't see the alarms going off, but life expectancy in the U.S. has gone down 3 years in a row now, which has not happened before since we've been having statistics on life expectancy. And I think that there's been buzz about that being related to opioid epidemic, and that's a contributor, but actually the underlying obesity epidemic is the most important long-term driver of the decline in life expectancy. And we see rates of cancers that are related to obesity that had been going down, like colorectal cancer. Those rates are going up now in people under age 50, as that generation that became obese as children is now moving into the age of cancer and cardiovascular disease incidence. So there are some huge trends, but when we break it down by income and education, again, it's that life expectancy is going up in higher income groups, and it's going sharply down in lower income and education groups. So the answer, that's a long answer to your question. Can we bring everybody along? We can. Some countries are doing it, but it's going to take some extra attention and efforts if that's going to happen.
Yeah, I mean, it's a long, complicated answer to a big, complicated question. Do you see, if we can finish up on a note of hope, do you see optimism in the ranks here in the United States that we have an opportunity to bridge some of those gaps? It might not be too late to necessarily reverse that trend of kind of like the higher income people going off and being wonderful and healthy, and everybody else being left behind?
Yeah, well, we do see some places where if a lot of attention is paid to that. Actually, for example, in New York City schools, they've really had a concerted effort, and I have to give credit to Mayor Bloomberg for really paying attention to these issues that include public health and nutrition, and in all aspects of their city government. And the obesity rates have been trending down a bit in New York City schools, where they had been going up like the rest of the country. We do see, I think in Massachusetts, we are not seeing that same decline in life expectancy. I haven't seen it broken down by income and education in Massachusetts. I'm sure there's going to be gaps too, but these trends they're not inevitable. And we do see some places, some countries that are bending the curve in the right direction. But that they're isolated islands at this point in time.
Okay. I think that we are ready for your questions. Yeah. All right. Hope you guys, yes. Fill the queue. Okay. All right. Yeah, sorry. It's like I gotta reverse my chair here. So let's start off. As you can see, the top question: how important is it to buy organic and non-GMO produce?
Yeah, I don't put this anywhere near the top of my list of priorities, and I don't aim to be 100% organic. If there's organic and conventional side by side, well, I will often usually get the organic, but from a health standpoint, not necessarily. The differences are not very clear. Clearly. That's part because we do have regulations in this country about use of herbicides and pesticides, and we want to keep those as low as possible. We should probably have those regulations be tighter than they are. But from the direct health standpoint, there's no clear evidence that it makes a difference. On the environmental side, in general, the organic may be better, but again, it depends. It can still be either conventional or organic can be done well or be done poorly.
Okay.
So, yeah. It's a little more complicated than that.
So we don't have to go to Whole Foods.
Yeah, you don't. You're right. You don't have to. I think most importantly is what we buy, and it does matter how it's produced as well, but it doesn't break down strictly by organic or not organic.
Okay, that's good to know. For those of us who do go to Whole Foods every once in a while, but it's a little expensive / the lines are crazy. Yeah. Also that. Next question, can you talk about diet's relationship with inflammation? Is there anything we should stop eating or start eating, that may increase or decrease inflammation?
Yeah, that's a big topic, and it has become apparent over the last few decades that inflammation, as we measure it by biochemistry in our body, is related to risk of diabetes and cardiovascular disease. That's not the kind of inflammation you have when you get an infection or something like that. It's what we call a systemic inflammation. These inflammatory factors increasing in our blood. The biggest driver of that is actually overweight and obesity. That's the 800-pound gorilla when we look at predictors of inflammation there. So staying relatively lean and physically active will help reduce those inflammatory factors. Dietary factors have some modest effect on inflammatory factors, and the biggest factor is eating a lot of refined starches and sugar. Healthy plant oils, unsaturated fats like olive oil. There's a myth going around that omega-6 fatty acids drive inflammatory factors up, and people are told to avoid plant oils.
Where did that come from?
It comes from no data. There's a nutritionist from Greece who's gone around the world. I don't want to go into the details. There are two metabolic pathways that you're probably familiar with that metabolize omega-6 fatty acids and omega-3 fatty acids, and they potentially compete with each other a little bit. That's the hypothetical reason for saying that omega-6 fatty acids come from plant oils increase inflammatory factors. But there are dozens of studies that have looked at this in humans, and it's not true that omega-6 fatty acids actually, if anything, tend to reduce inflammatory factors.
So just to be clear for the audience, there's no published data that says that that causes inflammation.
Right. Yeah. It's not that there's no data. There are dozens of studies
that show basically the opposite.
Right. Yeah.
Yep. There you go.
So, but the general pattern that we see, like a traditional Mediterranean diet, does have anti-inflammatory effects. Some of it's because it's more whole grains, less refined starches and sugar, healthy plant oils like olive oil, lots of fruits and vegetables. All those factors push us toward an anti-inflammatory pattern.
So remember, Mediterranean diet. Pitched it a couple of times. Look it up. Next question. Is it enough to change diet, or is governmental policy needed to make meaningful change against climate change? And, is such policy feasible? This is actually something I was wondering about too. Is this something that, the government is going to have to step in and try to set parameters, like what you were talking about, where it's illegal to produce trans fat in the United States? Are we going to have to do things like that to reverse climate change and potentially make certain aspects of diet healthier?
Yes, I think we're going to have both individual change and policy changes to make this happen. As I mentioned, part of this is linked with green energy sources, and that, again, it's individuals make choices about what kind of car they drive, and other changes that influences their energy impact. But as we've seen, we've had policies that were pushing us in a good direction, and now policies that are pushing us in a wrong direction. So policies are important, and but very often you can bring this down almost to supply and demand, which is real. We have a family farm in Michigan. My cousins actually own it, but we get together there every year or so. And like most of the Midwest, our family isn't farming it anymore, but rents out the space, and it's flattened into mass monoculture of corn and soybean.
Yep.
Now, should we tell that farmer who is producing all that corn to just switch to producing healthier foods? That he can't do that I would like him to produce nuts and vegetables and fruit. But if all the farmers in the Midwest do that or move a big step in that direction, then if there's not the demand for it, it will rot. The farmers will go out of business. It'll be an economic disaster for them. So we do have to create the demand for it, but we can also help support that demand by combinations of taxes and subsidies that will make it more affordable and more accessible for people to make the healthier choices. But a lot of this, in almost everything we've seen, policy change has started at the local and individual level, like on smoking legislation. Actually, there's still no national ban on smoking in restaurants. That all did start with towns like Brookline and New York City, then whole states banning tobacco. And there actually are a few places in the country where you still go into restaurants and they're smoke-filled. And trans fat ban the same way. It all started at local level, and finally, after it was mostly solved, it happened at the national level. So I think there's a combination and interplay of individual behaviors, local policies, and national policies seem to be the last that come behind. So we do need policies that would help that farmer move in the right direction. It's going to be right at the moment. The way he's farming is because that's what's economically viable for him. He's not getting wealthy. He's struggling too. And part of this land should go back to being fallow. It's really interesting to just look at what's happening. All that corn that he's producing, in the end, only 10% is eaten by humans. About 45% is fed to animals, 35% goes to ethanol production for driving big cars. Some of it goes into high fructose corn syrup, but only 10% of the grain produced in the United States and consumed in the United States is actually eaten by humans. And if we look at what we're doing with the land, only about 5% of our agricultural cultivated land is for producing fruits, vegetables, nuts, and legumes, all the healthy stuff. So we could double or triple that, and it would still be a tiny part of the land that we use. So that's not a constraint, but the economic policies that and food system structure that lead that farmer to do what he does do have to be changed. Some of that will be by increasing demand, but you can see we could increase demand a whole lot, and it would still only have a really big impact on what that farmer is doing.
I was going to say really quickly before we go on to the next one, do you think then that starting things locally might be a better incentive than like the federal government just being like, you should do such, because there's obviously the issue of like states' rights. So do you think it should kind of start on the ground first as opposed to coming from above?
Well, we have to take every opportunity that we can. If we have the opportunity to act locally, we should. But maybe we'll have enlightenment at the national level too. We came within a few. We almost had Bernie Sanders for president. You can imagine what difference that would make. Yeah.
Yeah, it's like maybe people will care about science in the federal government again. Who knew? So next question. This person works in R&D for large food companies, and in the center seat for change. Should we push for green packaging or ingredients first? So I guess green packaging. So I guess like proper like bagging and such. I think, or kind of like more more materials, ingredients and such.
Well, I think, again, wherever you are, we should work on better solutions. If you're working in packaging, yes, work on green packaging. What we package is probably most important. But I think, again, everybody, wherever they are, working toward a better objective is very important.
Yeah, and it's like you have a lot of places that have more like organic bags, so they switch away from plastic and things like that. I know we have our designated bags that we carry to the grocery store all the time. So, and you think that is perhaps something that we should focus on more, perhaps even than we do now, perhaps even more so than the ingredient part?
Well, from a health standpoint, direct health standpoint, what we're putting in those bags, what we're packaging is most important. But still, all of those things are important, and we can all play our role.
Yeah, absolutely. I've read that animal protein is helpful in preventing neurodegenerative diseases such as Alzheimer's, ALS, Parkinson's, and such. Is there evidence to prove this?
No, we are studying that, but
we tried.
Interestingly, there is some evidence for Parkinson's disease that the overall Mediterranean diet pattern is beneficial. That's about as close as we can come, and quite strong evidence that fruits and vegetables are beneficial in reducing risk of dementia. Actually, we have a lot of studies that show that. The animal protein, though, that we don't really have that evidence at this point in time.
But do you think then, are there publications that or labs that are working on, trying to continue to prove that link? I guess.
Definitely, we and other people are looking at that. Again, there's pretty strong evidence. In fact, Frank Sachs in our department is conducting a randomized trial of a Mediterranean-type diet, slowing cognitive decline and preventing dementia. That's ongoing right now. It's a pretty big trial, also being conducted in Chicago. But the evidence, the rationale for doing that trial is based on many studies that, in fact, do provide pretty strong evidence of benefit.
Potential breakthrough coming soon, maybe. John asks, how much better is pork or poultry than beef? Good question.
Yeah.
At least for me. I would definitely like to know the answer to this.
Yeah, definitely they're not all the same. The poultry, both from a health standpoint and an environmental standpoint, is much better than beef. The basic composition of pork, the fat that comes with pork when we eat poultry, is about 25% polyunsaturated fat. It's only 4% for beef. So there's a big difference just in the chemical composition of these foods. And we see in our long-term studies, consistent with that the risk of cardiovascular disease and diabetes is quite a bit lower for poultry compared to red meat. Pork we so far haven't been able to see a difference from beef. There may be some subtle differences, but that hasn't been clear yet. From an environmental standpoint, it's also pretty much in that order too, that poultry is quite a bit less environmentally impactful than beef. In part, that is the standard chicken fryer you buy in a store comes to market in only about 6 weeks compared to 2 years for beef. So that animal is not breathing so long and burning energy all that time. So the efficiency of feeding the chicken to chicken as we eat it is much more efficient than for beef. Pork again is sort of in the middle there, but quite a bit higher than for poultry.
Interesting. Yeah. I guess next question. Staying on the red meat thing, is cheese as bad as red meat?
It's sort of in between red meat and plant-based protein.
So it's kind of like the pork of meats that we just talked about.
Yeah. It's still, dairy products still have a heavy environmental footprint. Again, much less than red meat, but quite a bit more than, say, nuts and legumes.
Yeah, and it's like, also interestingly enough, thinking of like, what's the dairy coming from? Cows, and like, what are the big, perpetrators of, greenhouse gases that we've been talking about? Cows,
Yeah, right, exactly. But again, the conversion of what you feed them to milk is more efficient. And there is this, sort of looking at how we use our land is, I think, one way that I find helpful to look at this. There's some land, like parts of Texas that are semi-arid. You can't grow any crops there. You can graze some cattle with a very low density. But you can't even use it very well for dairy because the animals are roaming all over there. You've got to bring them in for milking a couple times a day if you're going to do dairy. So that probably that's where we should be producing beef, and it won't produce a lot of beef, and that's why having it occasionally would work. Dairy, there are some hillsides in Vermont. That green grass, again, not so good for probably not good for cultivating. If you're going to have cattle there, we should be using that for dairy because it's more efficient than using it for growing beef. So those are sort of how we should use our land, and we shouldn't be feeding grain to cattle. That is just very inefficient conversion, and environmentally produces a lot of greenhouse gas, whether it's for feeding grain to dairy cattle or for even worse for beef cattle.
It's like, yeah, grain's really inefficient for not just cows, inefficient for us too, apparently. Thank you all again, by the way, for your questions. Loving this. Keep them coming. I hope we'll be able to get to all of them before we have to stop. But thank you again. What's your opinion about fish consumption? Yeah, so this is kind of another offshoot of how is seafood? Is it environmentally and healthy?
Yeah, from a health standpoint, fish has positive benefits, in part because of its high omega-3 fatty acid content, which those fatty acids are essential, and many people are not getting enough. So, but we can't fish more out of the oceans. We're overfishing already. So we're sort of at our maximum production there, and any increase is going to have to come from aquaculture. And like pretty much everything else, there are good ways to do that and bad ways to do that. And it's an area where we should invest in research and really optimizing production. An environmental standpoint, if we are going to have some animal protein, fish is really an efficient converter of what we feed it to edible fish.
Interesting. Yeah, I guess that makes sense. So it's like fish, not so bad.
Yeah.
So for vegans, which meat substitute products are healthy and which should be avoided? So kind of another like do and don't question.
Yeah, well, I think the main sources of concentrated sources of protein for vegans would be legumes, including soy products, which we see to be very healthy, and nuts and seeds. And we do get a modest amount of protein even from rice or grains. So having a combination, particularly emphasizing nuts. When we look at our long-term studies, nuts are the winner every time. It is really amazing. But it's not surprising. You look at the composition, nuts are packages of nutrients that are really very healthy and good for us. So eating in our global analysis, increasing nut consumption around the world should be a high priority. And peanuts are to be included. Interestingly, they are quite very efficient in terms of their per land, the amount of nuts that we get.
Okay.
And they also don't require application of nitrogen fertilizer because they are legumes and produce the nitrogen themselves.
Okay, actually, that's because I was thinking about that. So they're kind of extra efficient in the sense that you don't need to necessarily spend extra resources on them when they produce their own. When they kind of handle that. That's actually very interesting. Didn't know that. Almond trees, Deanne asks. Almond trees take so much water to grow. Therefore, I switched to oat-based milk and almond milk, or versus almond milk. Does this make sense? So switching to oat-based versus almond milk.
Yeah, it's definitely good to have that oat-based milk as an option, and it's been used in Scandinavia for several decades now. And the fact that nuts and almonds in particular consume a lot of water isn't reason to avoid them. We really should be producing them in a way that's sustainable, and California is the biggest almond producer there. They still, we did some calculations. They do consume quite a bit of water, but interestingly, we have on one of our working groups someone who's involved in a hydrologist from University of California in Davis, and his point is that a lot of the water that's put on for almond production actually sinks into the earth and replenishes the aquifer. So a lot of this is locally recycled water. So these calculations need to take that into account. And if you do also calculate the water that's needed to produce milk by growing alfalfa in California, and it is a big producer of alfalfa that's then fed to cattle. That actually uses as much or more water, and much of that is not recycled locally. So that it's probably worse to produce milk from that same growing space in California than to produce almonds. And again, like everything else, you can do it better or you can do it badly. And there's a lot of research there using different varieties of almonds and also using precision agriculture to give them just the right amount of water that they need and not any excess. So I don't think we should avoid almond consumption, but where it's being produced, there should be careful attention to how it's produced. And I think it would be worth investing in growing nuts in other places in the United States. There's a lot of potential for that, and we just haven't made those kind of investments. Like in Michigan, where I grew up, you can produce walnuts and probably hazelnuts too, but we just haven't invested in research and learning how to do that effectively. You won't get to go back to the almond milk, though. There are nutrients that you get from almonds that we don't get from oats. So having some of both, whether we get them in milk form or just eating them more directly, it's not one or the other. We should have both nuts and whole grains like oats.
Interesting. I have to confess here, I had actually not heard of oat-based milk before. So again, you learn something new. Whenever you come to Boston Brilliance.
Yeah, this is sort of an interesting cultural trap. Why we think we need to drink white beverages.
You said it, not me.
Yeah.
So next question, we have a little bit of a recipe help call here. Finding it challenging to find attractive, so it's like, tasty but doable, without too much trouble, but also healthy recipes. So what kinds of things do you suggest?
Well, fortunately, there are lots of good recipes for this. Of course, I have to plug my own book, Eat, Drink, and Be Healthy, and I don't get any royalties for it. But, these were designed to be healthy recipes as well as be. I didn't create the recipes. The former editor of Cooking Light did those in the last round. I have a lot of friends who write cookbooks and ask them just to contribute recipes. So there are lots of recipes there. And the good thing is, too, also, like where we live in Cambridge, if you walk along Mass Ave now, there are lots of vegan restaurants there. Some of them, like Clover and other places, they don't advertise themselves as being vegan restaurants. And I suggest, even if you're not a vegan, going in there and trying some interesting ways that they prepare food that are very good and tasty. And a lot of it is they pay attention to having good, basic, fresh ingredients there that a lot of us just don't experience when we eat in lots of other places. And in this area too, we can borrow a lot from other cultures that where the culinary traditions are not animal sourced. They may not be totally vegetarian or vegan, but have lots of other interesting recipes. Clover, for example, has a great African peanut soup there, which is very nutritious. It can really be, it's very filling, a whole meal by itself. Lots of great recipes from Southeast Asia, which has some of the healthiest dietary traditions around the world as well. So I think we can borrow a lot from other cultures in finding diets that are both healthy and enjoyable at the same time.
Interesting. And almost like kind of jumping into the next point off of that, Daria asks, what are your favorite plant-based dishes?
Well, lots of things that my wife makes a really good nut lentil meatloaf with having a really nice spicy sauce makes it especially really good. So there's no one particular, lots of soups that can be made with very healthy ingredients. And Middle Eastern food, again, there's lots of plant-based sources there, that meals with falafel and salads. many different kinds of salads there. It's interesting that if you go into a typical restaurant or cafeteria, almost all the salads are loaded up with cheese now, which is sort of strange that has to be part of every salad, and it doesn't. I think wherever I see cheese, I think nuts.
Yeah.
They come in lots of flavors and varieties, so weaving nuts into what I eat is one of my major eating strategies.
Interesting. I'm gonna have to try out some of that, like the peanut soup. That sounded amazing.
Yeah, you'll enjoy it.
Yeah. And then last question, we made it, guys. John asks, how important are transportation aspects in eating locally? So we've talked about transportation in terms of the environmental aspects, and then eating locally sourced foods.
Yeah, there's no one single paradigm that captures what we should do from a health standpoint and environmental standpoint. So I would put those among the things to look at. But if you're going to a farmer's market and there's corn brought in by a pickup truck from central Massachusetts, that's local, but that's probably really burned a lot of fossil fuel getting it here. There are ways to aggregate and bring it more efficiently. On the other hand, there's a train that comes to Boston about once a day from Florida, bringing fruit up, the fruit train, and that is actually, even though it's a fair distance, that's pretty efficient kind of transportation. And when it's off season, where we can't in some of the months here produce fruits very well at all, that's actually relatively efficient. Flying food from South America or other places around the world is a very inefficient way of transportation. That's sort of the worst. So I think we should definitely work on and support local food. I would put seasonal pretty high in that mix of things too. The idea that we should have tomatoes available all year round just doesn't make sense. Because they're producing tomatoes by heated greenhouses in New England all year round. That's not good, efficient local production. But we can produce greens almost all year round in climates like this, and that is a really good way to emphasize local production. So I would. Again, first of all, the most important thing is what is the food. If it's beef produced by feeding cattle in New England, that's still going to be not a healthy or environmentally sustainable product to be eating. Having some modest amount of grass-fed beef occasionally, that still could be okay. So this isn't necessarily about being totally plant-based. You can if you want to, but it doesn't have to be that way. We can have tremendous variety and enjoyable foods that are produced sustainably. That's the basic bottom line.
Excellent. That's it. Okay. Thank you guys so much. Thank you. Thank you. Thank you.
Thank you. Thanks.
Thank you all. Thank you all so much for all of your questions. Thank you for your participation. Just wonderful. Thank you for coming to Boston Brilliance. It's been a treat to get to do this for you. And our next event coming up on June 10th will be Eric Lander of the Broad Institute, one of the fathers of the Human Genome Project. So you're going to want to hear about that. I know I do. I have a lot of questions to ask this guy because I kind of learned about him when I was in graduate school. So that'll be fun. And have a great night, you guys. Thanks again.
Good. Okay.
Because this is coming from the College Board, and it comes hand in hand with the SAT, that one of the things this is doing is just furthering or continuing